What is the obesity situation in Australia?
So in Australia, we've seen over the last decades a rapid rise in the increase in prevalence of obesity, similar to many countries around the world. So if you look back to 1980, it was less than 1 in 10 adults living with obesity, and now it's about 1 in 3. um, in children, it's risen from similarly less than 1 in 10 living with overweight or obesity to about a quarter of children living with overweight or obesity. So it's quite a rapid increase, and it's now a large prevalence, including if you can kill both overweight and obesity. Now with adults, it's about 2/3 of the population. So it's something we really need to act on, given that obesity leads to a number of chronic conditions, including cardiovascular disease, diabetes, but also disability and mental health disorders.
What are the views and missions of the Obesity Collective regarding to the public health issue of obesity?
So the Obesity Collective was formed really to try and bring together a wide range of different stakeholders who are all interested in trying to make a difference with regard to obesity, make lives better for people living with or affected by obesity, and try and really make a difference in terms of prevention of obesity into the future. So some of the unique features of the Obesity Collective are that it's really focused on that multi-sectoral, multi-perspective kind of approach, so bringing lots of people together, but also that it's quite focused on the lived experience, so trying to give more of a voice to those who are impacted by obesity, and through doing that, really think about how to make life better for more Australians.
There is a complex relationship of obesity with the environment that we live in. What factors do you think drive this relationship?
So I think the environment that we live in is really one of the strongest risk factors for the increasing prevalence of obesity that we've seen around the world. But funnily enough, it's only been relatively recently recognised as one of the risk factors. So originally people had that really traditional view of obesity, that it's calories in versus calories out, and all that was required to reduce obesity was more willpower, stronger personal choice, so that we ate less and moved more. And so while the biology of that is somewhat correct, we do need to eat less and move more if we're going to reduce the prevalence of obesity. What we've recognised over the last couple of decades is that actually what's driving that is the really complex interactions between us as individuals, who are kind of genetically bred to conserve energy and to, take in calories wherever we see them from the hunter-gatherer days, and the environment that now is really overly abundant in terms of energy-dense, calorie-rich food and drink, and also an environment where we hardly need to do any energy expenditure anymore. So it's really driven big changes in our energy intake and our energy expenditure. And it's only now that we're starting to recognise that unless we play with those levers, so unless we really change the environments that we work, live and play in, we're not going to be able to reduce obesity.
What is the food environment and how does it shape our eating behaviors and health outcomes?
So the food environment can really be imagined as every interaction we have from the day that we're born to the day that we die with food. So what are all the different contexts and situations and environments in which we're offered food, we see food, we purchase food, we eat food? And obviously that's a whole range of environments. I guess what's really interesting from an obesity perspective is to think about the retail environment. So where do we buy food and where do we buy and consume food? And also those environments where perhaps food is provided through care. So things like kindergartens and schools, even hospitals where, you are there at the courtesy of the government and food is provided in some way. And so what a lot of people across the world are interested in is what are the policies and interventions that we can put in place so that the food that is provided and displayed in those environments is the healthiest food possible. And what we know is actually a lot of the things that drive our interest in buying a piece of food or a drink or eating some sort of food are really driven by characteristics in the environment. So they're things like promotion of food. What is it that's uppermost in the fridge when you go to buy a drink, or pricing? So what do you see the 2-for-1 offers on? Where do you see all the advertising? And what we know is that predominantly all those kind of marketing attributes are really focused on the unhealthiest food and drink options. And that's been demonstrated to be a really large, excuse me, that's been demonstrated to be a really large driver of our interest in buying and consuming unhealthy food and drink.
What would you say are the three most urgent issues in the food environment that we need to address in order to create healthier food environments?
So thinking about what makes a healthy food environment, I think is a really good question for all of us to take on, because it is going to require a response from everybody. It's not going to be possible for retailers, for example, to change what they supply if consumers don't purchase it. It's not going to be possible for consumers to purchase it if retailers don't supply it. So we have to kind of accept that the food retail environment really is an interactive environment where we're going to have to actually act on consumers and retailers and policymakers all at the same time. So we need to kind of engage with communities and governments and business. And I guess the main point is to think about, what's the state we want to achieve. And I guess what we're aiming for is schools, kindergartens, hospitals, sport and recreation centres, and the local shopping strip, all to predominantly have healthy food as the preferred option. And then that way the consumers start to see healthy food as the preferred option, and it's a virtuous cycle. I think some of the key policy and intervention strategies that we need to work on right now to get to that preferred future state, if you like, is start to kind of say, in those areas where children are really predominant, so schools and kindergartens and daycare, we should really have a zero tolerance policy on unhealthy food and drink. There's no reason for them to be consuming unhealthy food and drink. And we've done really well in what you might consider daycare, but if you go then and look at secondary school, we haven't done so well there. And if you look at our tertiary institutions like universities, they're only really starting to think about the care of their staff and students as a priority in terms of healthy food. So I think we need to have zero tolerance in those settings, and really only healthy food and drink should be that which is promoted. And then I think we need some really strong government policy levers. So they're things like banning, for example, price promotions, which they've just done in the UK on unhealthy food and drink. So supermarkets online are not allowed to give you price promotions if it's an unhealthy food or drink option. And then the area where I work, which I think there's a lot of really interesting work to be done, is working actually with the businesses themselves, so with the local cafe or the food retailers in a hospital, to try and find out how might they be able to change their food practice so that consumers buy much more healthy food and less unhealthy food, so that the consumers are happy and healthy, but so are the business retailers.
There are a number of social and economic inequalities in Australia, such as socioeconomic, ethnic, and regional status. How do food environments change across these varying gradients of inequality, and how do they impact health outcomes disproportionately?
So we know that the prevalence of obesity is definitely aligned with socioeconomic gradients. So there are many, many studies that show there is much higher prevalence of obesity, both in adult and children, in regional and rural areas, in communities with lower income, and in some of our more disadvantaged populations. And so it's very clear that the more structural barriers, if you like, that a community group faces, the harder it is to access and consume healthy food, and the harder it is to enjoy healthy levels of physical activity. That's obviously for many complex reasons, as we've discussed, but one of them is the food environment. And we know, as an example, that both the promotion of unhealthy foods, advertising when you walk down the street or when you go into a supermarket, is much higher in low income areas. So there's much more advertising of unhealthy food and drink in low income areas. And we also know that if you go into rural areas, that it's much harder to purchase healthy food, so your fruit and vegetables, at a comparable price. So we know that, if you think of things like transport to more distant areas, there are some exorbitant prices on fruit and vegetables in some of our regional areas. So there are some really basic fundamental drivers of purchasing, which anyone in sort of economics or marketing would be able to tell you about, which align with our socioeconomic gradients. And so it's going to require quite forceful policy to change those. There's got to be real policy incentives to lower the price of fruit and veg, for example, in quite rural and remote areas, but also a lot of community activism. So some of the work that we've done in Southwest Victoria has been really working with the community to find out if they would like to demand more available, less, more promoted and cheaper healthy food. And once they demand it, then that also flows through the whole kind of business supply chain.
What do we need to do to effectively implement health policy initiatives and prevent strategies to create healthier food environments?
So I think that there are three key things we need to do if we really want to see change in this area. One is engage with communities and the lived experience voice. And I think that's been really neglected. So it's quite remarkable when you have conversations with people, or perhaps it's not that remarkable actually, but when you have conversations with people, people all want the best for their children, they want the best for their families. And most people understand that eating a healthier diet and having more physical activity is better for them and their children, their families and their communities. Where the tricky bit is what do you do about that? And as we've discussed, that requires community intervention, business intervention, policy intervention from government. So one of the main things we need to do is to really amplify that community voice. It needs to be clear to the businesses and to government that communities want that change. The second thing we need to do, I think, is engage more with those who are responsible for supplying the food and drink. So there are clearly some issues potentially around conflict of interest that really have to be thought through deeply. But where there are win-wins, they should be sought. So there are some interventions that exist where the retailer will sell more healthy food and drink, and as a consequence, they will have a better thriving business. So we need to find those win-wins and we need to promote them. And then the third area is we really need strong government leadership, and that hasn't been very present in Australia. We don't have an obesity strategy. We need an obesity strategy. We don't have a nutrition plan. We need a nutrition plan. So I think that we really need leadership from the top in Australia to say that there are some zero tolerance areas around healthy food provision to our children, and that we're going to put in place the best practice policies to achieve that.
In the context of obesity, what is the future outlook for research in the food environment, particularly with regards to the use of technology and information data?
So I think that information technology and data and digital solutions are going to play a really large role in being able to monitor whether we are having success with intervening on our food environment. So as anyone could imagine, the food environment is a really complex set of systems, and there's lots of indicators of success or lack of success of healthy food intervention. So we need to know what people are buying, how healthy the food is, what they're consuming, and that's very difficult to capture. There's no good databases for that. And we also need to know things like, are the policies around marketing, for example, or price promotions working? So if we were able to get a policy implemented in Australia that banned price promotions on unhealthy food and drink, how would we know if that was being complied with? How would we know if it was working? And so there's some really innovative work going on at the moment looking at both sort of digital scraping techniques. So how can we scrape the online environment to monitor what are the different big supermarkets doing, what are different cafes doing in terms of advertising and price promoting their food and drink. So that becomes a routine database that we can then access. But also, how can we then have a look at, for example, advertising through the eyes of a child? So on their walk from home to school, can we routinely monitor how much advertising they are detecting? And so some of the work that we're doing with some kind of fancy digital goggles is trying to prototype our ability to have routine monitoring of our food environments over time.
In the context of obesity, what can we as individuals do to combat this issue?
So I love this question. And often when I finish a talk, and particularly if it's an area such as a hospital, and I'm imagining, many members of the audience might be working in health, I often end by saying it's really important to think about your spheres of influence. So as an individual, you can't do everything. but everybody has a sphere of influence. It might just be yourself in the end, or it might be your family, or it might be your community, or it might be your hospital. What is your sphere of influence? And to then have a look at that sphere of influence and have a think about, well, are there any simple actions that I could take or we could take collectively that would improve the healthiness of the food environments that the Australian people are exposed to? And so I think hospitals are a really fantastic place to start. You know, when I have conversations with people about food environments in hospitals, some people can't believe that not every hospital only sells healthy food. It's like, well, wouldn't that make sense? Because they're in the business of keeping people healthy. And it's just not our business model. So I think that, you know, where something is sort of so logical like that, where it would actually make a lot of sense to most of the population that hospitals that are in the business of keeping people healthy would only provide healthy food, that's a change we can act on. And there are some health services across Australia and the UK and the US that have done that now, and they only provide healthy food and drink. So that's something that every single one of us can take up. You know, if we work in a hospital, then we get together the like-minded people, we take it to the leadership, get the leadership on board, and that's a policy change that is supported by government that can actually change.
Awesome. I think that's all the questions that we have for you.